in relation to delays and waiting lists. Obviously, the Child and Adolescent Mental Health Services are consultant-led community-based services provided by 6 multidisciplinary teams in Limerick City and County. City and counties from 0 to 18 age group, Clare is 0 to 18 age group, and North Tipperary 0 to 17 age group. Now, I've read some other articles that have said in the past that it was 0 to 16 in North Tipperary and Clare, but obviously that has changed. But instead of 0 to 17 is not at the age of 18, which is an adult. So I'd like clarification around that first of all. And obviously if somebody's on a waiting list and goes on a waiting list at 16 and is on that waiting list for approximately 2 years, that pushes them over the 18 threshold, so they have never actually got to avail of the CAMHS services. So I want to highlight that here today. Also, in relation to this, that in Limerick, the emergency and out-of-hours services operator offers a same-day assessment from Monday to Friday during normal working hours for children presenting in crisis. Consultant child psychiatrists provide out-of-hours service to the emergency department in the University of Hospital Limerick. This is not replicated across the country. If inpatient treatment is required, the first preference is to admit the child to a dedicated CAMHS unit in Galway, St Anne's. If the unit has temporary capacity pressure, then admission to a paediatric ward or public unit with special staffing arrangements in place is considered. Now, that's from the HSE itself. Why are there not CAMHS beds available in Limerick? This was called for in this House some time back by my predecessor and also by myself at one of my first speeches when I was here, and I've had no update on that. So that's of huge implication to people of Limerick and the Midwest, which obviously affects North Tipperary and County Clare as well. The waiting lists also. In Limerick Central we've got 25 on a CAMHS waiting list. In Limerick East we've got 56. And in Limerick West, which I represent myself predominantly, we've got a waiting list of 63. Now, the HSE have cited factors that are currently affecting the Limerick waiting list include 2 members of the West Limerick team on extended sick leave, consultant over 2 months and social care leader over 6 weeks. Why is there not some sort of temporary staff measures put in place to alleviate this? Because we may not know how long these people may be out of work. And that's not through no fault of their own, but I know working in the private sector you have flexibility arrangements, and when somebody's out of work, somebody can come in and fill their place from a temporary point of view because it's a demand-led service. Issue 2 is that one psychologist on the West team was not replaced whilst on maternity leave but is due back to work before the end of March. Again, why isn't the flexibility there to alleviate on this? And staff members that have resigned and have yet to be replaced on the Limerick team include 1 senior psychologist, 1 nurse, 1 occupational therapist and 1 CHD, all approved for replacement. Again, why are these not recruited? Routine appointments were not scheduled for at least 10 days to accommodate the move of the 3 Limerick teams to a new premises at Rossbrine Road building during February 17, which will greatly enhance the provision of the service. I welcome this. Also, new referrals have increased, it states, by 15% from January to February 2017. So we're seeing an increase in the demand, but the flexibility arrangements are not in place for people who are off sick, and obviously the recruitment arrangements haven't been put into place either to recruit the staff. So if we could get clarification around these issues, I'd welcome it.
Thank you to the Deputy for raising these issues. First and foremost, I suppose to point out the policy of the HSE, and it's in its annual service plan and reflected in that is that young people under the age of 18 receive age-appropriate treatment, and that obviously when needed that they are placed in age-appropriate settings. Now, we know that that doesn't always happen 100% of the time, but obviously the goal is that that would be achieved. CAMHS has been prioritised in new funding, which has been made available since 2012. If you look at the additional resources, it means that we now have 67 CAMHS teams, and again, I'm not saying that these teams are operating at 100% because we know they're not. We have 3 paediatric liaison teams, and this is supported by 66 operational CAMHS beds nationally. Now, that's 66 beds that are operational. There is availability for 76 beds, but again, we have a difficulty with recruitment of staff. Until we hire a lot of that staff, we can't open those full beds. With regards to the 20 beds that I think you've discussed that were promised in Limerick, as far as I'm aware, this goes back to Minister O'Malley and I think there was a discussion at the time of opening a new unit itself in Limerick, but if we add up the 76 beds, obviously with the anticipation that we will fulfil all the staffing needs, plus the new beds that will be available for the new Central Mental Hospital, that will actually total the amount that was recommended for the Vision for Change. Now, obviously, there's a review that's happening at the moment around the Vision for Change, around the figures. You've rightly said the number of people that have been referred in Limerick alone and in that area alone has increased by 15%. If you look at the number of children that are coming into the system this year alone, it's about 8,500. So obviously those figures need to be revisited. So whether or not Limerick could come back into the sphere at that stage, I'm not 100% sure. I think it is important to stress, however, the lack of funding for mental health services is not the problem here. As you've rightly pointed out, the various difficulties with recruitment of staff. So 2 members who were sick, I think the difficulty that it was extended leave. You don't know when people are going to come back. The replacement of maternity leave, that is a problem across the board, and particularly with mental health services, where you have a huge number of our mental health nurses are actually young women, and the fact that we can't replace any maternity leave, that's something that we're obviously trying to work outside of the Department of Health as well. The new furloughs you've mentioned, and then obviously the recruitment of new staff, where all replacements have been approved, but they haven't actually been able to fill the posts. So there is a huge difficulty with recruitment and retention of staff, and it's nothing to do with funding. The new standard operating procedures, which was introduced in June 2015, has provided greater clarity and consistency on how the specialist mental health services for children is delivered nationally, and there is a huge amount of work being delivered and currently worked through by the HSE, which is obviously trying to ensure that our younger people stay away from the CAMHS services. CAMHS should be specifically for young people under the age of 18 that have severe mental health problems. So we have the development of self-harm nurses within all of our level 4 hospitals, and they don't just obviously work with young people, but they train people within the hospital how to deal with young people when they come in. We have the development of new eating disorder mental hubs. We have dual diagnosis clinical programme, where we have young people coming in with specific alcohol and drug related issues, which are affecting obviously their mental health as well. And we have the development of a new transgender programme, which at the moment is focusing specifically on over 18, but that there will be a new programme for our young people as well. The service plan for 2017 provides for further development of CAMHS services, and this includes better out of hours liaison and 7-day week response cover, against a background, as I've said, where we've had an increase and will have an increase of 8,500 young people this year. Around 18,500 children will attend HSE CAMHS services this year, including around 14,000 referrals, and all of this information is published on the HSE website, particularly for CHO3, which includes Limerick and consultant-led community-based services. They're provided by 6 multidisciplinary teams in Limerick City, County Clare and North Tipperary. And I suppose to answer your question around the ages of 18 in Limerick and Clare, or under 18, the reason that they don't have, as far as I'm aware, services for the 17-year-olds in County North Tip is because this requires a clinician or a consultant post, and they haven't actually been able to fill that. So to have a person of 17 there, they require that post as well. Perhaps I could maybe come back to you on some of the issues. Sorry.
But I'd like to thank the Minister for her reply, and for 1 minute do not question her commitment in relation to this. Obviously, one of the big things that I know she's brought on is the 300 hours of mental health classes to help students maintain their well-being in the post-primary school sector, and that's a very welcome and looking, I suppose, prevention and helping people out as early as possible. But I do have to highlight again my frustration, and obviously the people who are on the waiting list, their frustration in relation to this and the issues that are born out of here. I think we need to have a look at work practices if there's not flexibility there in relation to covering people on certain types of leave or on indefinite sick leave as well, because the bottom line is there are people on the waiting list suffering, and the waiting list is increasing because of this. It is a demand-led service. I've worked in the private sector all my life, or most of my professional life, and when you work in a demand-led service and one of your team members or somebody in that team is out of work, there is a flexible arrangement or a type of flexible work model in there in which somebody can cover that, or the team can cover those hours to maintain the service. And I think that's something we need to look at, and that's with respect to everybody working in the service. I don't for a minute question their commitment as well, and their enthusiasm and how they approach their work, but this is a system and a systemic a change that we need to look at here. And obviously there is recruitment numerous challenges around that. I think we need to work harder, and I think the HSE need to work harder in how they're addressing these recruitment shortfalls. They need to find solutions in relation to this. There's always a solution in recruitment, and it's finding that and looking at the wherewithal in which they're working on this. But I really do need to stress and highlight to the House that there is people on these waiting lists, and we need to catch these problems as early as possible, because early intervention is what this is all about. Thank you.
Just to say that I 100% agree with the Deputy and I think the Minister for Education this evening, who will be rolling out the 400 hours of the mental health or the health and wellbeing classes within our schools, which is very much needed. And I suppose this is the area that we need to start focusing on more and developing more. Again, it's keeping our young people out of the mental health services, out of the specific CAMHS services, because if you look at where our funding is going, 80% of our funding goes towards the specialist services, and it's actually dealing with 20% of our people. So we need to start bringing more of those people into the primary care services and the primary care teams, which is why we're developing these programmes outside of the clinical specialist CAM team, so that young people don't have to go into them. What we've also found, and even just looking at, I suppose this is a snapshot of the whole country, not just within your area, the number of people waiting under 3 months is over 1,000, but that number has come down dramatically. If you look at the number of people waiting for over 12 months, that's halved in the last 2 years. And actually what we found for a lot of the people who are waiting up to 12 months, they're actually waiting for diagnosis, because we have become a country, I think, and we have turned into a system where if you manage to get a diagnosis, then you find yourself able to access services or the supports that you need a lot easier, and I don't think that's the way that we should be going. So sometimes you have young people in the CAMHS services that actually don't have a severe mental health problem, and they're left within the system for too long waiting for that diagnosis. So that's something that's trying to be addressed at the moment, and that's with the development of services through education, through our primary care system and through the CAMHS service. But again, I do agree we have a massive difficulty with recruitment of staff within our CAMHS team. Some of them are operating at less than 50%, which is not adequate. It's not sufficient, and there is a body of work being done at the moment to see how we can bring in various other I suppose organisations or various other skills that will be able to work with our younger people that don't require specialists, maybe psychiatric nurses or the clinical teams as well. So I'll keep the Deputy updated on our progress today.